David Stewart here, Program Director for the Health Insurance Program at AHEC West. And this question, there's some flavor of this question, what plan should I pick? What's the best plan for me? Is something that a navigator gets asked all the time. It's also a question that we can't be seen to steer people in any particular direction. What we do is we help you understand your plan or the plans and your choices well enough that um, you'll know what is the best plan for you, right? We do that. Now, if you just want to have somebody tell you what plan is best for you, you need to talk to an insurance agent or broker. And in Maryland, because we're part of Maryland Health Connection, which is Maryland's Affordable Care Act health insurance marketplace. You can go there, click on Find Help, fill out a little form, connect with a broker, or you can call this number and ask for Broker Connect. And those folks can help you by saying, yeah, you should, in your circumstances, pick this. They're also required, like a navigator, to act in your best interest. So let's do a little level setting here and let's talk about what are you actually buying when you get health insurance. So one thing that I like to say about the Affordable Care Act, which dramatically expanded access to health insurance for people all over the country and in Maryland, um, it was sort of like we gave everybody a brand new car, but we skipped the driving lessons. We skipped driver's ed, the driving school. We just skipped all of that. So um, there was just sort of this expectation that maybe that people would understand health insurance, and that's just not the case. So at its basic level, you are becoming a member of a plan offered by a health insurance company, right? You're signing a contract. And what you get for that contract is membership. And that membership includes access to facilities and doctors and negotiated rates for health insurance services, right? Now, one of the things I'll just say about health insurance services is that the Affordable Care Act sets standards that had never been in place before. So any plan you get at Maryland Health Connection meets standards. So you will have the essential healthcare services that you need. The other thing that you get when you purchase health insurance is protection against financial risk, against future financial risk, right? Um, every plan comes with an out-of-pocket maximum, which is the limit to what you can owe. And oh, by the way, when you join a health insurance plan, the insurance company is agreeing to pay some of the costs. They share the cost with you, the consumer. And what their share of the cost is at the beginning, it's less. But if you have a lot of healthcare expenses at a certain point, the insurance company will take all of the cost off of you. Okay. There's another video that you can watch that explains all of that. But when you're trying to figure out what plan you want, it's really it's about knowing how you use healthcare. How often do you need it? Are you young and you go once a year, if that? That's one way to be. Um, but basically, all plans are equal when nothing happens. And what I mean by that is if you're not going to the doctor, if you don't have an emergency department visit, if you don't have things happening that require you to get services, there's no cost. You still have that safety net of an out of pocket maximum, meaning if something happened and it was big, there's a limit to what you can owe. And the insurance company will cover the rest, right? So, but what about when things happen? When there's a diagnosis, when there's an accident, when there's something that requires you to start needing regular health care. Um, so what I'm going to do is I'm just throwing this out there so you can be thinking about this, as you think about what kind of plan you want or what you're going to choose. And one of the big questions is, um, how how am I with risk? Am I someone who I know for a fact I just want that protection for the big one? Therefore, I'll pick the lowest premium I can find, right? And one of the main reasons for getting Affordable Care Act insurance and Maryland Health Connection insurance is that there's financial help available to lower what you pay, right? There's a couple different flavors of that. We talk about that in other videos. But think about, am I only in it to protect myself from the big one and I'm willing to just pay for whatever happens comes my way? Or do I know already I'm going to need it a lot? And therefore, I'm going to have to pay more attention to the plan design, right? And when I say plan design, um, there's just each plan has its own unique blend of copays, coinsurance, deductibles, out-of-pocket maximums, and premiums, right? So typically, and bronze, silver, and gold are just categories of plans. They had to be named something. So the idea is bronze is a cheaper metal, silver is a little more expensive, gold is more expensive still. In Washington, Allegheny, and Garrett counties, the area that I serve, these are the primary plan levels that people have access to. So the most upfront cost will be on a bronze plan. Silver plan, it's kind of in the middle. You'll have less upfront costs for services. And then if you get a gold plan, you're going to have the least upfront cost, but there's a trade-off in premiums. Bronze plans typically will have lower premiums for most people. Silver will again have higher premiums. Now, in our topsy-turvy world right now, silver plans are the most expensive. Okay. Gold plans, but the basic idea is silver and gold plans have higher premiums than bronze. Um, so something to think about. We all have monthly budgets. We have to factor that in. However, just because a plan has a lower premium does not mean it will be the lowest total cost over the course of a year, right? If you're paying more for services because you have a bronze plan and your deductible is higher, your deductible applies to more services and things like that, then you could pay a lot more out of your pocket in a year than if you were on a silver or a gold plan. So whether you talk to a broker, an agent, or a navigator, really ask questions um, related to how you use healthcare so that we can look at what is likely to um, cause you to spend more money or less money up front. So some of the questions that will help you along this journey, um, for example, let's say there are some people who have a decent amount of savings and they can cover the deductible amount. They can cover any services that the deductible applies to because they already have that money in savings. Uh, Not everybody's in that situation. So, but if you are, that's good. You can go for that low premium, high deductible, assuming you're willing to spend down your savings on a deductible and for healthcare expenses. Now, on the other hand, if you have medical conditions, type 2 diabetes, for example, quite common these days, and you need regular care, if you know this about yourself, then I would encourage you to be looking at silver and gold, even if the premiums are higher, because you could likely spend much less over the course of a year. And again, are you only worried about the big one? Um, what I say about that is, it's not uncommon for somebody to spend a few days in the hospital and come out with $100,000 bill if you don't have health insurance, right? Now, I took a look, and I think right now the highest out-of-pocket maximum for an individual in Maryland Health Connection is $9,450 for a in the bronze, silver, and gold categories of plans. So 9,450, way less expensive than 100,000. And if you don't have health insurance, you're agreeing to pay 100% of the costs of whatever happens. You're liable for that. So just keep that in mind. Medical expenses are still the number one cause of bankruptcy. Bankruptcy can affect buying a house, things with your family. It has a lot of ramifications for your financial life. Now, just here at the end of the video, I just want to highlight that every plan, bronze, silver, gold, whatever, covers certain preventive services at no additional cost. This is not an exhaustive list of those, but your annual preventive physical, no cost to you. It's included in your premium, whatever that premium is. Cancer screenings for a person of your age and sex, included. Um, Vaccines that are recommended for your situation, COVID, flu, etc., um, also included, as long as they're preventive in nature. Okay, all plans, this comes at no additional cost. This is our contact information for those of you in Washington, Allegheny, and Garrett counties of Maryland, however, and all our services are free. But statewide in Maryland, there is a connector program, and we have colleagues everywhere. All services are free, and here's the contact information for those folks. I hope you found this useful, and give us a call if you need help.